Thinking about seeing a chiropractor, but you're a little nervous? You hear your friends telling you things like, I saw my chiropractor earlier today, or my chiropractor told me to sleep this way or that way, or a chiropractor fixed my sciatica when no one else could. And you hear these things, but there's a little part of you that still thinks about James Bond and how easily he could kill one of his enemies with a simple twist of the neck, and you think, nah, I'll just go get a massage instead. If that's you, you're not alone. I bet you 5% of the people who come to my office are there, they showed up, but they're still a little nervous about being adjusted. Normally what I like to do, if I can sense that in advance, is ask them if they're nervous since it's their first time seeing a chiropractor. If they say yes, I'll reassure them by looking them in the eye and saying, it's okay, you're not the only one. Then I'll usually take their file and begin looking through it and say, let me just make sure you gave us an emergency contact person in case something goes wrong. Now, they usually laugh at that, and the best part of this is that chiropractic works really fast. And when I take them back and do adjust them, close to 100% of the time, a person walks out of their first visit with greater motion and less pain than when they walked in. Now, do I actually say that to them? Yeah, I do. Sorry, I think it's hilarious. Maybe it's just chiropractic humor. And if you're coming in to see me and you're a little nervous, I'll probably say the same thing to you. But you know what's great? When you go from having pain when turning your head to the right, and then you get off the table a few minutes later and you can fully turn your head again and you have no more pain, you'll make that connection right away. That chiropractic is gentle, quick, and it's safe. So you'll know at that point, chiropractic is benefiting you right away. And like I said, it's even more gentle than you thought. Now, if this is the first time to our channel, welcome. I'm Dr. Charlie Oliver. I am a chiropractor and a physical therapist practicing in San Antonio, Texas, where our tagline is bringing the best of both worlds together to help our patients. The same philosophy goes for this channel. We want to bring you information, content, and experience from both professions to help empower you and help you take charge of your health. So if you're nervous about chiropractic, you're not alone. Let me tell you, I was a physical therapist for 5 years before I decided to become a chiropractor. And while maybe I wasn't directly taught that chiropractors were quacks and were dangerous, that's exactly what I thought for the first few years of my career. Matter of fact, what happened was, even though I didn't have a very high opinion of those professionals, I was realizing that they were helping patients that I couldn't help. And quite frankly, that made me a little bit jealous, and jealous enough to where I started looking into exactly what they do, started looking into some of the textbook they use. It actually made me change my career. So I went from thinking, oh my gosh, these guys, they're really dangerous and they're quacks, into thinking, oh wow, they're doing some really remarkable procedures that are helping people that no one else does, and I want to get in on that. First of all, if you saw our video, watch this video before seeing a chiropractor, you found out that an adjustment really isn't about putting a bone back into place. It's more about restoring motion where it's lacking. In other words, our job as chiropractors is to find out which bones in the spine move like they're supposed to move and which bones are stuck, and then to restore normal motion. That means we don't have to get a crack and pop. Most people love the sensation they get with a good crack because it reflexively drops muscle spasm and it feels amazing. But in the long term, it doesn't matter whether it cracks and pops or if it doesn't. It's all about movement. So with that concept in mind, we can get motion in many different ways in addition to a traditional chiropractic adjustment. Let's start with some of our gadgets. Number one is the arthrostem. This device is moving the individual bones of the spine. Now I'm going to demonstrate this on my assistant, the arthrostem. So this device moves the individual bones of the spine. Now we're able to use this on the neck, the mid back, and the low back. And patients always ask me about this. They say, what exactly does it do? Well, what it's doing is it's also stimulating a lot of nerves within the spine. So it's loosening up muscles, but as I said, most importantly is it's getting the individual bones to move on one another. We can use this on people who are hesitant about being adjusted, but also I can use it on people that I don't want to do a normal adjustment on, like an elderly person with osteoporosis. That's the thing, it's working on speed, not power. So we can use it even on people who've had surgeries. Now, the next tool is called the activator. The activator has an entirely different approach to it. And again, kind of like the arthrostem, what it's about is it's a very quick but gentle impulse which puts motion into the spine. The third tool is called the integrator. This comes from a technique called torque release technique. And kind of similar to the activator, it's going to give a very quick, very powerful adjustment. And so it actually helps a bone move, but remember, all of these things, they end up stimulating the central nervous system. So a lot of times when we use this this method, I'll be checking your leg lengths and we'll be able to see an adjustment in one region of the spine, altering how the brain is functioning, and that will actually pan out in changing which leg is longer versus which one is shorter. The fourth big tool besides an adjustment is a mobilization. And so a mobilization, think of that as something where, again, we're gonna put motion into the spine, but we probably won't hear a crack and pop. Again, we can get the spine to move, we can get the individual vertebrae to move. We just don't have to put as much force into it. And again, for someone who has osteoporosis or who has some other type of condition where we don't want to cause more of a stress or strain on the system, again, somebody who maybe just had a surgery, we can use a mobilization on them. So whether you're nervous or just curious, chiropractic care is all about restoring movement. It's not just about the crack and pop. It's about getting your body back to feeling its best. If you found this video helpful, hit that like button, subscribe, and tap the bell for more great content. As always, thanks for watching, and I'll see you in the next video. Have a wonderful day.